The Delta variant continuing to surge across the country, with the U.S. now hitting case levels not seen since February, according to Johns Hopkins University. Joining us now, Dr. Kavita Patel, fellow at the Brookings Institution, former White House health policy director under President Obama. Dr. Patel, thanks so much for joining us. I want to talk first and foremost about back to school, since that's on a lot of parents' minds, and it's key to also getting the workforce back to work. And I'm wondering, in your view, in communities with high spread, what needs to be done at the school level to make sure that the environment is safe? Is it mandatory mask wearing for all the children? I mean, what would you do?
Yeah, thanks so much, Melissa. Good morning to all of you. So we've heard the phrase layered mitigation, and that's exactly what schools need to do. What does that mean? Highest priority really is high quality masks, especially indoors, combined with a series of measures, if possible, 3 feet of distance, ventilation. I would say that many schools are struggling with the distancing, so masks and ventilation. And that means, honestly, open windows, outdoor lunches where possible. Kids need to take their masks off to eat, obviously. And as much as we can to keep the ventilation in a room, especially many of these old schools have a challenge. And those are probably the highest priorities. I'm going to mention something you've heard Dr. Scott Gottlieb also touch on this. Testing. I can't stress this enough. We've already seen schools that are open that have had positive cases. And in some states like Texas, you can't do contact tracing. Parents are going to need to know, is their child potentially exposed or positive, even if they're not symptomatic? So testing should be a part of the strategy, even if it's not supported by the school, that parents should consider.
The recommendations you just laid out, do they differ for children who are above 12 and vaccinated versus under 12 and not vaccinated?
Yeah, great question. So the CDC really does recommend K through 12. So that includes a group of students who would be vaccinated over the age of 12. Unfortunately, you are seeing states interpreting, or at least putting that recommendation into policy in different ways. So you are seeing some states that are not recommending masks or not enforcing masks for vaccinated children over the age of 12. And, you know, I don't know about you, most children are kind of in transition in different grades. So you're going to have schools with grades that have mixed children wearing masks and some who are not. And candidly, we all know now that indoor masking is recommended for vaccinated and not. So I do worry that the 12 to 17 age group might be in some sort of a blind spot. Another statistic, keep in mind that in some parts of the country, only 20% of 12 to 17-year-olds are vaccinated, generally kind of under-vaccinated compared to adults.
Should we be thinking more about going to pandemic sort of precautions in schools, and that might include moving the school year to entirely remote because certain populations are not vaccinated still?
Yeah, you know, this has been, I think, one of the toughest questions to wrestle with. I do not, looking at the data, and here's why. We do know from schools that were open, daycares and camps that were open, that did follow these measures, even in the height of some of the winter surges that we saw last year before a vaccine was available. We know that it's possible to keep these schools open and safe. It does seem ironic when we've got states that have so many cases, Florida, Texas, Louisiana, et cetera, and that we are talking about schools that have already opened this past week, for example. But I will tell you that at some point we have to be pretty strict about how much we will do to protect our children. Keeping schools open and keeping them safe should be hand in hand. And to your point, it leads to, I think, bringing our society as much to the cusp of normalcy as possible, allowing us to work, allowing us to have some sort of schedule that can give our children an environment to thrive and allow for adults to have a productive workplace. All of that being said, we need to focus on vaccinating as many people as possible in parallel. But I do not believe schools should be remote. I do think many schools, we've already seen it, are going to have to flip to virtual because they're going to have outbreaks and cases. I'm watching that closely in these states that are not masking. We have some data sets from Garland School District in Texas and others that have already shown positives on day one, and how they're handling that will likely lead to remote schools for some of these children.